Greetings, everyone. Today we're going to hear about a very sweet little girl who got cancer and was getting care, but then she lost her coverage when she fell through the cracks created by ObamaCare. And we're going to find out what can be done about that. Welcome to an independent conversation coming to you from the Independent Institute here in Oakland, California. We're a stone's throw from San Francisco across the bay, and we try and bring an independent outlook on the issues and events of the day. So today, ObamaCare, but from a very special angle, and I have two wonderful guests who are going to help us get both the personal and the policy angle of this little girl's story. First, let me introduce John Goodman. Welcome, John.
Glad to be here.
Delighted to have you here. John C. Goodman is a senior fellow here at the Independent Institute, also president of the Goodman Institute for Public Policy Research. John's a PhD economist from Columbia University, where he taught. He also taught at Stanford, Dartmouth, Southern Methodist, University of Dallas. You will probably have seen John Goodman on television, like on the Fox News Channel. I think you've been spotted, John, on CNN, on PBS even, Fox Business News, CNBC, published in the Wall Street Journal. And you are known as the father of health savings account, and really the person who probably has better than anyone else mapped out the future for viable healthcare in America that can actually work. So thank you for all that work you've done, John Goodman.
Well, thank you for that introduction.
And of course, you've published books with us before, like A Better Choice and Priceless Curing the Healthcare Crisis. And indeed, not next month, December 15th, we're going to be publishing this new book, New Way to Care, Social Protections That Put Families First, that addresses healthcare, among other things. But more about that book later. Now, our other guest is Christopher Briggs. Christopher Briggs is a communications specialist in Northern Virginia, who also advises our team here at the Independent Institute. We are delighted to have you with us, Christopher. Thanks for joining us.
That's a real privilege. Thanks for having me. It's great.
Mr. Briggs has a firsthand close encounter with the ins and outs of Obamacare and what it does deliberately and what it does inadvertently. So we're going to start with you, Christopher, if you don't mind. I want to hear a little bit more about what happened earlier this week. Well, I guess the background of it I should give people, which is that everybody is reading the New York Post these days, right? But I'm glad for that, because that means they're probably also reading your op-ed essay, which appeared on Monday in the New York Post, which was called, "My Kid Has Cancer and Obamacare is Making Everything Worse." Heart-rending story in there. Tell us a little bit about Colette. How old is she now, and how old was she when she first came down with this terrible diagnosis?
She's now 7, and she was diagnosed with cancer in November of 2015. So we're coming up on the 5th anniversary of that. And it's been quite a journey for us, full of travail and sorrow. And it's made all the worse by the fact that the healthcare that we're able to purchase for her, is colluding against her in a way with the disease to make it even harder to get the care that she needs.
Oh, man, to have the personal trauma plus the insurance trauma together. Well, Colette's a beautiful little girl. Last time I saw her, she had 2 dark pigtails in braids. And
that's right.
She looked both like her father and her mother, and she had a beautiful smile.
Yeah, that's right.
But a few years back, you tell us in this op-ed about how your wife got this horrible phone call. Tell us how that got going with your family.
Right. So the long arc of the story actually starts back in 2004 when I decided to go out, leave corporate America, and start my own company to do the work that I now do. And I only made that decision because I first investigated the insurance market. Obviously, I have a fairly large family. Colette is the last of 9 children. And when I investigated the individual market before the Affordable Care Act took place, there were so many choices. I had to bring in a broker or two occasionally to explain all the choices that we had. So we had a plan that was working for us quite well. And when Obamacare became law, I was really panicked about it because I knew that there was just no way that the promises being made by the President Obama were going to be kept. We were going to lose our doctors and lose our specialists. And that's in fact what happened. In 2014, when it came into effect, within about 2 weeks of the year turning into the Affordable Care Act regime, we got a letter from our provider at the time saying that we had lost our plan, and we lost all the specialists, and premiums immediately went up.
Was that before or after her diagnosis?
This is before her diagnosis. So
wow.
this was in 2014 when it came into effect. So premiums went up, and Dr. Goodman can talk more about this. But one of the hidden secrets of Obamacare, although maybe not so hidden anymore, but it was at the time, is that one of the great devastating things is the increase in the maximum out-of-pocket and deductible expenses. Those went through the ceiling, even more than the premiums did. So we were already dealing with that problem.
Yeah, you were worrying as a father of a large family, but then the call came. And
the call came in 2015 that Colette had not been feeling well for quite some time. We had blood work done, and we weren't quite sure. We'd been dealing with some Lyme disease in the family around the same time, so we thought maybe she had Lyme disease. And it came back that she didn't have Lyme disease. She, in fact, had leukemia. Wow. My wife was on the phone. I happened to be in the room with her at the same time, and she collapsed on the floor, and we scooped her up and got her to the hospital. It was a 2-hour drive in rush hour traffic, and she was hours away from dying. We got her just in time.
Wow.
Yeah, and
so you were thinking, well, at least we have insurance coverage, still a little bit.
Exactly. So, well, we ended up losing our plan again in 2016. It was an even more expensive plan. Premiums were even higher. The maximum out of pocket was now close to $16,500. And this was in 2016.
And how was Colette doing at that point?
Well, at the time, she was responding well to treatment. I mean, it's a pretty brutal treatment. Leukemia requires, for the case of little girls, a 2-year plus treatment, highly invasive. Wow. It's delivered in 3 different ways, mostly at home by her mother. She had to suit up in a mask and gloves just to get her to eat.
Oh, man.
It's so toxic that you can't touch it. We had to get her to eat it effectively.
Oh.
And then it's delivered intravenously through a port in her chest. And then this last bit is actually really important for the next part of the story. One of the main ways that they save these children is by jamming needles the size of your pinky into her spinal column while fully sedated to kill the cancer cells in her spine. And that became really relevant as we move forward into the disease.
Because leukemia is very located in the spinal column, right?
Well, it's a blood disease, so the blood goes everywhere, and it can concentrate in the spine. And so you have to do this. And this, of course, should only be done in a hospital setting. And that became relevant when 2017 rolled around. In 2016, we were facing such extraordinary costs. I mean, we had, 9 kids to take care of, my wife and myself. One of my children had cancer, and we weren't seeing a penny of insurance money until October or November of every year. We were paying so much money.
Wow.
So this idea that Obamacare was going to, keep our doctors and be cheaper, neither of which was true. We lost all the doctors we had for the other children, and the costs were extraordinary. So what I did is I tried not doing this, but in 2017 I simply had to go into what's called the Affordable Care Act exchange market. Yeah. We actually had to buy subsidized healthcare because the premiums were going to be over $3,000 at this point, which is the size of a mortgage. I mean, it was just too expensive. So we went in 2017. President Trump, mid-year, that's in 2017, just merely suggested that we ought not to continue to shovel huge taxpayer subsidies to these insurance giants for care that was less comprehensive and far more expensive. And what we learned, I didn't know at the time, Dr. Goodman probably could have predicted this, that the law allows insurance companies, when they get nervous about their subsidies, to pull out of the marketplace. And so within about 48 hours, maybe 72 hours of President Trump merely questioning the wisdom of the ACA, every provider that we could have access to in Northern Virginia pulled out of the marketplace for the following year. So 17 was covered, but we had to pick a plan for 2018. There was nothing for us to buy except one plan.
And before Obamacare, you had chosen among 6 or 7.
Oh, even more. And as Dr. Goodman can testify, before the Affordable Care Act took place, the private insurance market was getting pretty diversified. You could buy all kinds of different riders and things, and we were actually beginning to experience some of that, and that all ended. So we went from half a dozen plans at least down to one plan for 2018.
Which then dropped you.
Well, no, the problem was that this plan, Cigna Connect, it's an HMO. It was the only plan left standing. Everyone else pulled out. They stayed in the marketplace. But they had made a business decision, years prior to this, that they were not going to cover the Inova Fairfax hospital system Whereas, as I had mentioned, she received these spinal infusions of chemotherapy directly
that was
into
the place,
her spine, right? So we effectively, for 2018, if we had bought this plan, would cover her care at her clinic, but she was completely uncovered at the only hospital in Northern Virginia that actually treats pediatric cancer patients. So effectively we're uncovered for 2018. The other effect of Obamacare that actually was very relevant here, besides extremely high premiums and incredibly high maximum amount of pocket, which by the way we still had to pay for, even within the exchange, we were still saddled with those expenses, is that the narrowing of care. So there was only one plan for us to buy, but we simply were tied literally like medical serfs to the counties that we lived near. So under previous insurance policies, if we had gotten sick with the plan I used to have before Obamacare, I could have easily taken my daughter to, for instance, the Children's Hospital of Philadelphia for specialist care, right? And I could have maybe even gone to Texas, where John Goodman is, and gone to MD Anderson. But as John Goodman knows, there's no longer any individual plans you can buy, even to this day in the state of Texas, as far as I understand it, where you can actually purchase it for your family and have your child go to MD Anderson. It doesn't work. So we had extremely high prices, very few institutions to go to, and the ones that we could go to were not covered effectively. So we were without coverage.
Wow.
For 2018.
Now, you turned to a place where most people don't think of turning or probably can't. You try to put some pressure on these companies to allow you to buy a plan. So how did you get that pressure?
Well, so being in communications, I kind of knew how to do this. And, I reached out first to the Wall Street Journal. They weren't interested. They never responded. So I reached out right after that to the Washington Post. I sent an email to their healthcare person. Within a matter of an hour or so, I got an email back, and they ended up sending somebody out to do a story on the fact that, that my subject line was, I'm a father in Northern Virginia with a girl with cancer, and I can't buy coverage under the ACA.
Right. It's still the subject line.
It's still the subject line, unfortunately. Right. So the Post came and did a nice story on us, got us a lot of attention. NPR pretty quickly picked it up and did another story on radio. But Cigna just wasn't willing to sort of budge on this. I mean, they had gotten caught in the retraction of the marketplace. They were left standing. They hadn't, as a business decision, they had made the decision long ago not to do this. And yet they were being called upon to do it. And
so you leaned on Cigna through the media, but also you had another leverage point, I think, according to your op-ed.
So I reached out to the political class, knowing that the political class, the Democrat Party in particular, had managed to tie the provision of health care to the political process. So in my view, the politicians are now responsible for my child. And I reached out to any number of things. The Republicans, I have to say, were not very helpful. In fact, extremely unhelpful. The only one that responded in any sort of meaningful way was Senator Warner's office.
Yes.
And when I got a hold of his staff, they heard two things. I wasn't happy that they had passed this law, but then I was extremely happy they actually stepped up to it and tried to apply some political pressure. I don't know the whole story here, but I do know that he was instrumental in getting Inova Fairfax Hospital and Cigna Connect together at the table to negotiate a plan whereby they would cover this hospital. The problem for us was that plan only became effective in April of 2018, long after I had made another decision, because I couldn't wait. The Affordable, Dr. Goodman can talk to this, but the Affordable Care Act requires, even to this day, requires consumers like myself to make a decision for the coming year by December 15th of the prior year. And once I make that decision, I cannot leave the program.
But the companies can leave the plan.
Well, this is what happened next, is that, anyway, so we had Cigna Connect for 2000. We had a private plan that I managed to squirrel together for 2018. 2019, we ended up buying that Cigna plan. And then and for 2020, we noticed in the Affordable Care Act exchange place, we had two choices. Cigna had come back, Anthem, which was our previous carrier, had come back in the marketplace. So we had a choice between Cigna and Anthem now. And Anthem had a better program. It was slightly cheaper, more doctors were covered, both the hospital and the clinic were covered. But my other children could go to see some of the specialists they had lost. So we did our due diligence. We called both insurance companies, Cigna and Anthem, called all the clinics, all the medical doctors you would need for Colette and other children. And both plans said they were going to be in for the year. So we bought the better plan, the cheaper plan that gave us more coverage, which was the Anthem plan. And I thought we may have sort of we're done with this problem.
But
well, I was wrong. I was
yeah.
wrong. Mid-March of 2020, this year, I get a letter from the clinic announcing that Anthem had just told them that they were no longer to be covering the pediatric cancer clinic starting April 1st. So we had about 10 days to figure this out.
Man.
And just to be very clear, there is no other cancer clinic in the region that you can send your kid to that will treat her if she has cancer, except this one. There's one hospital and there's one clinic. And if either go without coverage, you are effectively battling cancer on your own with no medical coverage.
So let me just fast forward you just a tad here. I think you turned again to Senator Warner, who helped again. Is that right?
Well, so unlike the previous time in 2017, where I was notified, the whole discussions got started in August or September of that year, and I had to December to decide this, figure out what to do. In this case, I had about 10 days. Because April 1 was literally 10 days away. So I reached out to the Post. They didn't respond to me. So I called Senator Warner's office immediately, and they did respond. And they, over the weekend, somebody from that office, I assume the senator, but I don't know, called Anthem. And by Monday morning, they had agreed to continue to cover the clinic through April 1 of 2021. And I said, look, if you guys don't figure this out, here's the news story I'm going to run with. Anthem refuses to cover kids with cancer in Northern Virginia during coronavirus. I mean, somebody made a really dumb idea, during coronavirus to stop covering kids with cancer in Northern Virginia. Well, thankfully that didn't happen. But my problem now is that the open enrollment, as Dr. Goodman will tell you, opens in just a few days.
Starts on Sunday.
And I have 45 days to make a decision, and Anthem is going to be one of the choices, I'm assuming. Cigna Connect is in there. And I don't know what's going to happen.
So
let me make one other point. So when we got this notice in March that we were going to lose our care for my daughter at this clinic in April 1, 10 days later, I mean, the first thing we did, actually, to tell you the truth, was we called the exchange and we verified that the Cigna Connect plan that covered both institutions that we needed, that we needed, was still available. I had chosen a different plan, but, couldn't I possibly get a waiver and buy that? It was still available. But they said, look, you haven't died because you're on the phone with us. They literally said this. You haven't moved, and you haven't been fired from your job, which I can't because I'm self-employed, right? So they said, you can't buy this plan. We can't talk to you anymore. And they hung up the phone.
Wow.
So Dr. Goodman will talk about this later. The asymmetry here between the consumer and the provider of insurance is one of the real instabilities of this act.
It sounds to me like one of the takeaways here is that if you fall into one of these categories of expensive, difficult care like Colette does, you can get care under the Obamacare system if you can apply political leverage. That's
Correct.
Not a very good lesson.
Well, right. So, in a way,
Well,
let me just say one thing about that. So in a way, I'm kind of a hero here, right? Because twice now, you know, there are other people in our situation at this clinic, both times. And I managed to get all those kids covered, plus myself again. But this is actually a sign of failure. Because, you know, I purchased, before Obamacare, you know, 2 wars in Iraq, a war in Afghanistan, the meltdown of 2008. I bought healthcare uninterrupted at relatively low prices with great coverage. You know, the Democrats tie this provision of bodily care to a political process that by definition is volatile. I mean, the American system was set up to be contentious and volatile, which is one of the strengths of the system, but it's not a good way to provide medical care to people. And we just got caught up in the problem here.
Yeah, you sure did. And
it's a sign of failure. I mean, I'm looking for a carve out that I managed to get, but I can't. How many times can I do this? This is not a system that works.
Other people can't get those carve-outs either.
Correct.
Joe Biden, presidential candidate, former vice president, presumably something of an architect of Obamacare, says this kind of thing doesn't happen, but it does. So turning now to John Goodman, thanks for hanging in here with us, John. We need your insight as a policy expert. What features of the Affordable Care Act caused Colette's coverage problem?
Well, there are 3 bad things. And the first is that we had a system designed to take care of families like Chris and his daughter. And it was a system based on risk pools. And most states had a risk pool. And they were designed to take care of families with expensive, difficult to treat health problems. And we replaced that system with a new system, Obamacare, where no insurer feels like they have the responsibility to do what the risk pools used to do. In fact, they don't want Chris and his family in their pool because they're going to lose money.
Mm-hmm.
Whatever premium Chris would be paying them, no matter how high it is, it's going to be less probably than the cost of care. So back before there was Obamacare in my state, which is Texas, if you were denied coverage by a private insurer, you went to the Texas risk pool. What you got was something that looked like a standard Blue Cross plan that was sold to employers, small groups. You could go to any doctor, enter any hospital. You had to pay more in premium, but the deductible was very reasonable. And we replaced it with something that's far, far worse. Now, the second thing has already been mentioned. There's an asymmetry here between the buyer and the seller. So the buyer can choose during a 6-week period a plan. He's stuck with the plan for a year. But at any time during that year, the seller can change doctors. He can change the doctors that are part of the plan, can change the hospitals that are part of the plan. So they can do whatever they want to do, but the buyer is stuck. Mm. And the third thing I think is important is what I call a race to the bottom. So we have a system in which there is some risk adjustment, so plans get some compensation if they have more costly enrollees. But it's a very imperfect system. And bottom line is nobody wants a family like Chris's family. So what we have is plans that exclude the best doctors, exclude the best hospitals. Mm-hmm. I live in Dallas. Our best facility is the University of Texas Southwestern Medical School. Some people regard it as the best medical research facility in the whole world. But you cannot today buy an individual health insurance plan in Dallas-Fort Worth, or anywhere in Texas for that matter, that gets you into UT Southwestern. So here are these great doctors, here's this great facility, and you cannot, with Obamacare insurance, get in there.
Who goes to those doctors in Texas then?
Well, everybody else. But remember, the individual market is a small part of the total market. It's only about
right.
5 or 6% of all the insured. So people who have employer plans, they can go over there. Mm-hmm. If you're on Medicare Advantage plan, which I am right now, I can go there. But Obamacare insurance is excluded. And down in Houston, we've already mentioned MD Anderson Cancer Center. They do not take Obamacare insurance. Mm-hmm. And the reason they don't take Obamacare is because what's happened in the Obamacare market is the kind of plans that have survived look like Medicaid with a high deductible. Mm-hmm. The most successful insurer today under Obamacare is a company called Centene. Centene started out as a Medicaid contractor. That's what it did. And then it entered the Obamacare market, paying Medicaid rates to doctors and hospitals, and combining that with managed care. And places like MD Anderson say, well, look, the rate is too low, and you're going to come along and question the bill. That's not worth it for us. And so you're excluded. So Centene has a fifth of all the Obamacare plans in the whole country. And what you're getting is Medicaid with a high deductible, and doctors and hospitals that don't take Medicaid managed care are not within your reach.
Wow. Well, I'm getting some questions from some of our audience who are watching with us here from just different places. Let me just read this one question to you, Dr. Goodman. I mean, I call you John. I think I can call you John if you don't mind.
Call me
right?
John. If you call me doctor, people think I can cure those.
Exactly right. You can cure our policy, but not our spleens, right?
Okay. That's exactly right.
Okay, so John, here's a comment from someone watching us who says, I thought ACA actually helped people with existing issues and covered more people than before. No. In fact, that's the great myth. What's happened is things are worse today if you have a pre-existing condition. Under the old system, when you enter the individual market, even if you were excluded from a private plan, you could go in the risk pool at any time during the year. Now, you can only enter the market during a 6-week period, and even then, you don't get insurance until the following January. And then the plans are competing not to enroll you, and so they don't want to have the best doctors and the best hospitals in their networks, because they know, like with Chris's case, that the only people who are going to really look carefully at who's in the network are people with a problem, and they don't want people with problems, especially not people with expensive problems. So I would say that
many, maybe even most people with a pre-existing condition who today enter the individual market have worse prospects than they would have had we never had Obamacare.
Wow. I mean, the facts seem to be opposite what we've been hearing, from the politicians for quite a long time now. So what's the way forward, John, and how do we escape these big chasms that have been created through Obamacare? Is there a better way, like fix it or replace it or what?
Well, let me comment on your first comment.
Yeah.
Why haven't you heard about this?
Yeah.
I blame the Republicans. If it were the other way around and you're having all these problems, if this was a Republican health plan, Democrats, if they had control of the House or Senate, they would have been holding hearings every week. They would bring in the victims and they'd say, look what the horrible Republicans have done to you. Republicans haven't done that. They've never had a hearing where they bring in the victims of Obamacare.
Mm-hmm.
And they don't talk about the problems of Obamacare in a serious way. And so we're only getting one side of the story. That's why you haven't heard much about the problem.
Well, no wonder. I mean, and Christopher had to turn to Democratic Senator John Warner. I mean, I want to still give 2 cheers for John Warner for helping you out, but I wish we didn't have a system that required John Warner to help you out.
Well, most senators are pretty good at responding to their constituents, and they don't tend to get political about that. But I'm now talking about something that would be political. I'm talking about a hearing whose purpose is to bring in victims of Obamacare and have them explain what's happened and use that as a tool to get Obamacare reformed. Because you ask, what can we do? We have to reform Obamacare. And in order to get people to agree that there's a real need, you have to convince them there's a problem.
Yeah, exactly.
And there are lots of problems, and Republicans have done a poor job of talking about them. And you wonder why Democrats haven't focused on the problems. Republicans are going to say nothing. Why don't Democrats seize the high ground? They haven't.
One of our viewers is commenting also, there are for sure areas that Obamacare doesn't deal well with, but don't you think the benefits it provides outweigh the negatives, John Goodman?
Well, the benefits it provides is they dumped a bunch of money into a market, and they're helping a lot of people who otherwise couldn't afford high premiums. Now, what I have said to my Republican friends is when you're talking about abolishing Obamacare, you can change Obamacare, but keep the money. The Democrats have put up money for health reform. Let's keep the money and do it the right way. And I think the right way is to give everybody a fixed sum tax credit and let the market compete. Let's have a free market for health insurance, but let's make sure that people have funds to be able to afford that.
So instead of dictating what providers can charge, you provide people with subsidies, depending upon their needs, I guess, so they can buy health insurance in a marketplace. Is that what you're saying?
Yes, and we have a very good model for that. It's called the Medicare Advantage program. So within Medicare, there is something called Medicare Advantage. And right now you're seeing it advertised a lot on TV because it's open season for them. And more than a third of all seniors are in private insurance, and they all pay the same premium. But what Medicare Advantage does is it pays more if you have a health problem. And so unlike Obamacare, in Medicare Advantage, you have plans competing for people with health problems. You have, if you look down the list of plans in your area, you'll see there are probably plans that specialize in diabetes or in heart care or in lung care. And so they're saying, we want you if you have these problems. And the reason they want you is because they get compensated. What happens if you enter a Medicare Advantage program, you appear to be healthy, but they discover that you have diabetes? What do? They go back to Medicare and say, well, Chris here has diabetes, we need more money, and they get more money. That's not happening in the Obamacare market. Interestingly, Medicare Advantage was created by Republicans. Obamacare was created by Democrats. You would think that Republicans would be smart enough to say, hey, we figured out how to do this, but they're not that smart.
I recently saw a document called Health Care Choices 2020, a vision for the future. You're one of the signatories of that. I presume you helped them frame that plan. Is that right, John?
I did. What we did mainly in that plan is we went through things that the Trump administration has done that no one knows about. When we entered this year, it was illegal under Medicare for a doctor and patient to talk by phone or email or Skype. Even if you weren't under Medicare, Facebook, Skype, Zoom, those didn't satisfy privacy regulations. So basically, the whole country was closed off from telemedicine.
Mm-hmm.
But the Trump administration had been working for 3 years to open the door to telemedicine. And then when COVID hit, Congress gave it the authority to go ahead, and it was ready. So the reason why you're able to talk to your doctor by phone or have a Zoom consultation is because of Trump. And also they opened the door and made it easier for employers to now to put money into an account so that you can have a direct relationship with a primary care physician. You can have the physician's cell phone number. So at nights and on weekends, instead of going to the emergency room, being around other sick people, you can get care and consultation in your home if that's appropriate. And the third really important thing they did, that was a total reversal from Obama, is employers can now give their employees tax-free dollars to purchase their own insurance, which they own and can take with them to the next job. So it's personal and portable health insurance. So these are
I like the
very,
sound of
very
that
important
portable.
reforms. And the last thing you need to know, though, is that they're all temporary. So when COVID goes away, these reforms go away, and that's what people should be running now
Right.
for office. They should pledge that if you elect me to Congress, I'm going to try to make sure these freedoms don't go away.
So was it the case that President Trump had some leeway because of the exigency of the pandemic to make these changes?
Yes, the Trump administration, the folks in Health and Human Services had been working on this for 3 years.
Mm-hmm.
But there was this congressional law. And so when COVID hit, Congress said, okay, we've got to do something. So they went ahead and let the administration do what it wanted to do anyway. And that is let Medicare patients use Zoom and Skype and phone to communicate with their doctors. And, older folks are the least computer literate. But in the cities, almost a third of all seniors by April had at least one telehealth visit. In the rural areas, it's 1 in 5. And that's pretty good for a population that is not supposed to know very much about computers.
They say old dogs can't learn new tricks, but I think maybe they can.
And very fast.
And very fast, yeah. So I think what's interesting to me is that, you're hearing people say, well, there's no well sketched out set of alternative policies that cohere that's an alternative to the Affordable Care Act. But when I'm looking at this Healthcare Choices 2020, which is just a copy of it, and also when I read the relevant chapters in your book, New Way to Care, I'm seeing a very well sketched out set of interlocking policies that in fact provide an alternative to the Obamacare problems and kind of remarketize the healthcare system and even provide for pre-existing conditions. Am I missing something, or is that right?
No. Now, what Trump has done so far are the things that are easier to do. I mean, it wasn't that hard to say you can talk to your doctor by phone. And it really wasn't all that hard to say your employer can give you money so you can have your own health insurance.
Mm-hmm.
Now, changing the subsidies in Obamacare, that's more difficult. And they haven't really come up with a well thought out replacement. But again, I think the best solution is treat everybody the same. Give us all a tax credit. Don't tell the insurers what they have to do. Let's have a real market, and let's make it work something like Medicare Advantage.
Now, what about the pre-existing conditions? Everyone's going to say that. And I saw in your proposal here some very careful thought about how to care for pre-existing conditions in a remarketized healthcare market.
We need centers of excellence. We need plans in the individual market that specialize in cancer care, for example. So they would advertise to Chris and his family and say, we want to take care of your daughter. Now, most people have seen Cancer Treatment Centers of America advertising on TV.
I've seen that.
They specialize in cancer care, but they're not in the Obamacare because they can't get a reasonable fee. So, and also it's illegal under Obamacare for a plan to specialize in anything. So what Cancer Treatment Centers of America does is they say, we only want you if you have cancer. If you have some other problem, you're not suitable for us. So you cannot do that. In Obamacare, you have to be all things to all patients. So we need to allow specialization. We need to allow the plans to screen out people who don't fit what they do, and ask for health records, ask health questions, and try our best to get the right patient to the right plan. Whereas right now in Obamacare, everybody's running away from the right patient because they don't want patients with problems.
So the pre-existing conditions thing, just in a nutshell, again, that's going to work out because if we retool the system according to your general principles, we would divert federal money that's being used for other purposes simply to subsidize those people so they could participate in the marketplace. Is that right?
Yeah, it needs to be profitable to take care of sick people.
Yeah.
And again, we know there are plans that want to do this. You see them advertising on TV, but they're not going to come into the Obamacare market if you make what they're doing illegal.
Mm-hmm.
And they're not going to come into the market if they can't get a reasonable premium that covers the cost of care.
I mean, we should all want good coverage to actually be profitable for the providers, because if it is, everyone's going to get a lot more good coverage.
Exactly. So we want plans to specialize and seek out Chris and his family, his daughter, and saying, come to us. We want to take care of you. By the way, that's what happens in other markets, if you think about it.
Mm-hmm.
I mean, most markets, what are producers doing? They're trying to solve your problems. And over in healthcare, what are they doing? They're running away from your problems.
Yeah, for sure. One thing I wanted to point out is I'm looking through your book here. There's this wonderful section in the back that I think every American should read. It's called What Socialized Medicine Looks Like. And you sketch out there, it's fact-filled and sobering discussion of what Medicare for all would really look like. You want to comment on that before we take an audience question?
Well, in other countries, you have bureaucratic systems, and they ration by waiting. And if you have a real problem, like if Chris were in Canada, he would have even worse problems, because if you think we underpay doctors in Obamacare, they underpay them even more up in Canada. And that's why we have a steady stream of people coming from Canada to the United States,
exactly.
often to get care they cannot get in their own country.
Right, yeah. If Canada's system is so great, why do they all come here for their most important needs?
Well, let's remember they don't all come here, but we are meeting lots of needs here. Hip replacements, knee replacements are a big example. The waiting times are extraordinarily long in Canada, and the seniors are living in pain. And American hospitals are doing something for Canadians that they should be doing for us. They're giving the Canadian a package price, so you know in advance what you're going to pay.
Right.
And it's typically what Medicare pays, which is half of what your employer pays. And so we know a market for healthcare can work because it is working. Canadians are taking advantage of it.
Right.
It's just, the rest of us ought to be doing what the Canadians are doing.
Because that's the unregulated part of the American health providing market, because the Canadians are not part of our system, so they just pay what the price is.
That's right. And they know what they have to pay in advance.
Yeah.
They have to travel. But by the way, any of you, if you have a problem and you're willing to pay in advance and travel, you can do what the Canadians do. It's just we're so accustomed to the bureaucratic system we're living with that we're not taking advantage of opportunities to save money and maybe even get better care.
Christopher Briggs, you may have a question that you want to pose to John Goodman. But before I ask you that, I'm just going to grab a question that's coming from our audience here. It's a pretty general question, but I mean, it's the kind of thing that we're all thinking about. The questioner asks, John, he asks, why do we need the government to tax us in order to give us our subsidized health insurance? Isn't that a shell game?
Well, since it is, they take money and give it back. But government is involved in healthcare. And so if we could have a world in which there was separation of government, of the state and the healthcare system, that would be fine with me and it would probably work very well. But that's not where we are. We're in a system in which government is paying half the bills. And so I do not think it would be politically practical to say, well, let's get government out tomorrow. But I do think it's practical to say, well, let's take all the money that the government is spending, let's divide it up, let's give each one of us our share of it, and let the market compete, and then we add other funds and have a real market for healthcare.
Right. Well, so somebody listening here, just to be really clear, because sometimes people get, they create caricatures. John Goodman's solution to these problems that Obamacare has created is not some kind of like withdraw the government wholly, ultra-free market. That's not what John Goodman is recommending. He's pointing out that there are ways to restructure government's participation that focus on appropriate incentives and market competition. Is that a good way of summarizing your view?
Well, and add to that, I really want a free market for healthcare.
Mm-hmm.
I really want the doctors and the hospitals to compete on price and compete on quality, and right now they're not doing that.
Mm-hmm.
So absolutely, I want that. But I think we're going to have government giving people some sum of money that allows them to enter into that market, and if you like, to even requires them to use the money we give them to go into that market, or they don't get the money.
Yeah,
that's basically what the whole employer subsidies are doing. We're saying to employers and employees, if you buy health insurance, we give you this great tax break, and you don't get the tax break if you don't buy health insurance.
Right, which is the opposite of a penalty.
Well, it's a penalty in the sense that if you work for an employer and you don't buy health insurance, you don't get the tax subsidy.
Right.
So a tax, the flip side of a subsidy is a penalty, and I don't care what you call it, but government is involved. But the something practical that we could think about is government's involvement being very, very limited.
Yeah.
So you get $3,000 a person, $10,000 for a family, and you can spend it depending on what the market has to offer. That, I think, is practical.
I can imagine just the blossoming of healthcare alternatives that would occur if we had that kind of government participation rather than the current kind. Christopher, do you want to pose a question to John Goodman before we bring things to a close here?
Thank you, Dr. Goodman. So you and I have talked offline any number of times. You've been very helpful in explaining sort of the situation that I've been in with my own family. One of the other people that I've talked to is one of your proteges, Michael Cannon of the Cato Institution. And he and I have been talking, off and on since my first episode. And he said, actually, your problem's a lot worse than you think, Christopher. And that is because your daughter got sick under Obamacare, which is not insurance. It's simply it's a scheme to pay each other's medical bills. Your daughter, because she's now had a terminal illness, is actually permanently uninsurable for the rest of her life. And actually, Obamacare is creating a nation of pre-existing conditions as a result. There is no more real insurance in the country, hardly at all. And that all the Democrats really have to do here is wait this out. And the pool of people, my daughter is one of them, just has to get large enough that you simply can't reintroduce a free market in insurance, because insurance, as the actuarial scientists understand it, is not even going to be possible. And my understanding is that your plan that you've proposed, or the pieces of your plan, really effectively boil down to this. We have created a problem through Obamacare and probably the group marketplace before Obamacare, where we've created a nation of pre-existing conditions. We have to have a system of government intervention to take care of those people so that the rest of us who've not actually had this problem can really then enjoy a true free market in actual insurance product. And so my question to you is it not the case that the group insurance marketplace, but even before Obamacare, really wasn't actually insurance? And the only insurance that actually, that you could buy was what I used to have, which was automatically renewable. You pay your premiums, pre-existing conditions were not an issue. And that was what was wiped out by Obamacare. So we have in other words, we need government assistance going forward because government was the problem in the first place. And that the goal here is to get the government limited to taking care of sick people who truly can't now be insured. So the rest of the population could actually benefit from true insurance. Is that not true?
Well, there's no question that government is the source of this problem. And the biggest way that government has been the source of this problem is that government encourages us all to have group insurance. Right. Because it said employers can provide insurance, but that can't be portable insurance. When you leave your employer, you lose your insurance. So when you get too sick to work and you go to the individual market, then now we have a pre-existing condition problem. So government created that problem. So I think what everybody needs to understand that's sort of on our side of the political spectrum is that we're going to have to take care of people who are sick. And the best way to do it is to have a market for sick people. And so we have centers of excellence, and they compete to solve problems. And people can buy into this system, and the price of their buying in has to be a fair price. So there are a lot of reforms that we could talk about, but I think we cannot get away from the fact that people who are sick and have problems are going to be taken care of, but let's create a market for their care and make it as competitive as we can.
Yeah.
I think that's really super helpful. Let me just kind of draw things to a close here by reminding everybody that, in fact, come December 15th, Independent Institute here in California, we're going to be publishing John Goodman's book, New Way to Care, Social Protections That Put Families First, which covers some of these issues as well as other safety net issues that are very much worth your attention. I encourage everybody to get a copy of this book and to look at other materials provided by John Goodman, both on our website, independent.org, as well as at the Goodman Institute. Looking back just to the personal story, Christopher, I think last time I asked you, you said that Colette was technically at the moment in remission. Is that still the case?
Right. So basically, when she was diagnosed, we went through this 2 years of intense chemotherapy, and then when that 2-year plus period is over, which for us ended in 2018, they stopped giving her chemo because the body really at that point can't take much more.
Oh, man, yeah.
And the protocols have basically figured out that that's kind of, for boys, it's a little bit longer. For girls, it's like 2 years plus. And we're in year 2 of this 5-year waiting period where if it's going to come back, it'll come back in the next couple of years. And typically when it does come back, it kills the child. I mean, there's a very low survival rate. So we're in this period where she's in remission. If you look at her today, you wouldn't really know she ever had cancer.
Right.
We can kind of tell by the way she's developed a little bit, but otherwise she's fine. But my anxiety, of course, as a parent, is that if I fall into one of these cracks again and it does come back, what do I do? Right? She's not technically cured until 2028, 10 years after her CC. Yeah. So we're in this period where
it's a tough period. It's
extremely So she goes in for blood work every other month now. It was once a month. And I can tell you, I mean, that is a very bad day in our family because we do not know.
I can imagine that. Yeah.
Because that's how we discovered it the first time was blood work, and we just wait.
I think that you and your wife have been careful about what you say to Colette about everything, both her own case and the public policy and so forth. So there might be people on this call today who happen to know Colette, and just be careful. Don't talk to Colette about all the details. We don't want her to be troubled. In fact, I think both John and I and everybody watching, we really want to send our best wishes and hopes to Colette, because she's a beautiful little girl, and she shouldn't have to be, the example of the failure of Obamacare. But at the moment, she is one of those examples. Yes. So thank you for bringing it to our attention. And thank you, John Goodman, for giving us your expertise and for working with us on this great new book, New Way to Care.
Glad to be with you.
Okay, so Christopher Briggs, thank you too.
Thank you.
Thank you to your family, and thanks to all those who joined us today with this independent conversation coming to you from the Independent Institute here in Oakland, California. Thanks to our friends at ThinkSpot, who are also transmitting this to their whole wide world of friends and participants. Join us next time. Take care. Bye-bye.